In today's Women's Care Wednesday, we're talking with a urogynecologist, Dr. Joshua Goldman from Women's Care Florida, and how this area of medicine is still relatively new, and most importantly, how they can help you. Welcome to the show. How are you?
Good. How are you?
I am well. I'm excited to chat with you because I love hearing about things from Women's Care Florida, that you guys are right on the forefront of things that are new and, more importantly, new ways to help patients. And that's kind of what you saw in your practice and have involved as a practitioner. Explain your background and how you have your certifications.
I have a background in obstetrics and gynecology. I was a practicing gynecologist with Women's Care Florida for over 15 years now. My focus in my practice evolved to treating women with pelvic floor disorders. And I was among the first urogynecologists boarded in the specialty in the country in 2013.
And what I think is really astonishing is you saw what your patients were dealing with, and you have a passion for helping their comfort level and their day-to-day lives, right?
Absolutely, absolutely. The difference with our specialty is we focus on improving the comfort and function that patients experience in their daily life with pelvic floor disorders.
It's one of those things that I've heard about, and I think it's something that people don't like to talk about. How important has it been, and the feedback that you've been able to receive, that a woman can go to you for her gynecological needs and then be able to seek treatment for something that they may have to go elsewhere for in the past?
So I don't do basic gynecology services. We utilize our gynecologists within Women's Care Florida. And when a woman has a pelvic floor disorder, which involves the connective tissue, muscles, and ligaments that support the pelvis at the bottommost part of the pelvis, they're referred to me, and we help improve their comfort and function in the way they experience their daily life.
Well, and I can tell before we started, you have such a passion for their daily life, because you were saying so many times, you know, you get wrapped up in doing like cancer screenings and the tests to talk about the future of patients.
Yes.
Why did you want to take a different turn?
Well, I think a lot of what gets missed in medicine is improving patients' comfort. Mm-hmm. Patients come in with complaints and worries and concerns about how they're dealing with either incontinence or prolapse or discomfort associated with problems in the pelvis. Mm-hmm. And a lot of times the comfort is not addressed completely. And improving the function and the way people experience their everyday life is something that we focus on here. And we can do that because we have other subspecialists around us that deal with all the other preventative medicine issues.
As a woman, as a mom, I feel like so many times you're dealing with symptoms and you're like, you know what, I got to focus on everybody else. I'm just going to put my things on the back burner.
Absolutely.
And I think that you must see that a lot as you're agreeing. If there is someone at home watching thinking, yeah, maybe I have some of those symptoms, but I'm on the fence, I don't know if I want to call, who are some of the patients that you want to talk about that they need to pick up the phone and not wait any longer?
Well, I think that anyone that has symptoms or discomfort can be helped. Mm-hmm. And not everything, I'm a surgical subspecialist, but not everything we do involves surgery. Most of what we do involves just creating good behaviors and good habits, improving quality of life through exercise and weight loss and weight management. And all of these things are available within Women's Care Florida.
I'm assuming you've received some pretty good feedback after
Absolutely.
you've made the switch.
Absolutely.
Can you share with some of the things that patients do say after they seek treatment from you?
Well, a lot of patients end up becoming shut-ins in their homes with incontinence, prolapse, and things that cause them to not interact with their family. Now, women take care of their family. Mm-hmm. It's a great part of what we do. But we end up seeing them postpone or put off caring for themselves. So in our specialty, we focus on bringing the focus back to the women and improving their life so that they can go on and treat their families and be with their families.
And live that life
and live that life that they want.
Right.
Yes.
Well, again, it was so nice meeting you today.
It's a pleasure.
If you have questions that fall under this umbrella, or as you touched on too, any other different umbrellas when it involves women's health, well, Women's Care Florida, they can help. There's the phone number you see. There's the website so you can get more information today.